Mike O'Shaughnessy, worked with Dr. Stanley Weiss, my PI this summer. So we had two cohorts that started in the 1980s, one in 1984 in New Jersey, and then one in 1987 in the whole United States. So we basically took that the cohort from New Jersey and the portion of the United States cohort that came from New Jersey and matched them to the New Jersey State Cancer Registry in order to look at their the incidence of liver cancer kind of amongst people that are HIV positive, HIV negative. We looked at it by race, ethnicity, and by sex. So previous literature says that people that have both hepatitis C and HIV are more likely to have things like liver fibrosis and cirrhosis and stuff like that. And like 98% of our cohort, they're all injection drug users. They were all enrolled from drug treatment centers. So 98% of them are hepatitis C positive. And so when we looked at the incidence of liver cancer by HIV status, we would have expected that the people that had both hepatitis C and HIV to have more liver cancer, but we actually found the opposite. We found that people that were HIV negative actually had significantly more liver cancer than people that were HIV positive. And people that were actually HIV negative at study enrollment, but then became HIV positive, had a way higher rate of liver cancer than people that were HIV negative or HIV positive. So kind of our big conclusion here was that the people that were HIV positive in our cohort, this was before really good treatment for HIV came out, so they were dying of kind of AIDS-related causes before they had the chance to get liver cancer, while the HIV negatives obviously weren't dying of AIDS, so they were able to get liver cancer at a higher rate. And then the people that were HIV negative on enrollment but then became HIV positive, they had HIV and HCV, and they got liver cancer more because there might be some kind of interaction between the two viruses and liver cancer, but they had less chance to die of AIDS because they got HIV more recently. And basically, that's our main result.
Hello, my name is Brian Moriarty. I am a second-year medical student here at Rutgers, New Jersey Medical School. And the poster that I am presenting today is the effect of topical vancomycin on diabetic fracture healing. I think the good place to start is that when doing basic science studies in a diabetic population, this study is on rat models, a very large portion of the time and effort goes into just maintaining a diabetic population. So here we have approximately 300 or 400 rats that essentially we are their primary caregivers. The rats do have diabetes, so it's our responsibility to track their blood sugar and make sure that they get their appropriate insulin so that they stay alive and are available for studies. The reason we chose to do this study, it's well known that in diabetics, fracture healing can be delayed up to 2 times the length in a healthy population. Additionally, diabetics are at a much increased chance of issues like non-union, pseudoarthritis, delayed union, so all sorts of problems in the diabetic population when it comes specifically to orthopedic problems. So because of that, it's very, very important to test the effect of all common adjuncts used in orthopedic surgery, specifically on a diabetic population, to make sure that we're not further impairing this bone healing. And topical vancomycin is a product that is very commonly used in orthopedic spine surgery. Essentially, the reason it's used is because instead of having to administer a systemic antibiotic that is so powerful and can have many side effects, by applying direct topical vancomycin to the surgical site, you're able to control infection in that area without some of the side effects you would see in a global antibiotic. So essentially what we did here is we had the rat models, a transverse mid-diaphyseal fracture was induced on these models, and just like would be the case in a human population, topical vancomycin was applied directly to that fracture site. The rats were taken care of and monitored for a period of 6 weeks. When we went ahead and removed those fracture sites and actually did several methods of study on them to test the efficacy of vancomycin and its effect on diabetic fracture healing. A couple of things that we did is we did radiographic scoring, essentially where x-rays are taken and measurements are done to look at how callus and bone bridging formation is taking place. We also, in addition, did micro-computed tomography, which is just a more detailed way to accomplish some of the same tasks. And then we also also do mechanical properties where we take those bones and we actually put them into a machine that breaks them and tests the amount of stress necessary to break them. And what we did, which was very successful, is we found that there is no difference when topical vancomycin is used on these surgical sites, showing that with further studies, obviously larger studies and in human populations, we can move towards the acceptance that vancomycin does not have a negative effect on fracture healing in diabetic populations. Thank you very much.
Hi, my name is Saida Rob. I am a upcoming second-year student at NJMS. So my project is titled Outcome of the TAP Block After Abdominal Hernia Repair. We're specifically looking at abdominal hernia repair because it's one of the most common surgeries that's done across the country and also worldwide in general as well. And TAP blocks are basically anesthesia blocks that are given before the surgery in order to minimize pain after the surgery. So the whole point of doing that is to reduce the amount of opiates that are needed after surgery. And the reason that we want to do that is because of the opioid crisis that's going on in recent years. So we want to see if the TAP block is actually decreasing and reducing the complications as well as the number of opiates that the patients are taking after surgery. So currently the economic cost of prescription opioid-related overdose exceeds about $78.5 billion annually, and 33% of that cost comes from health insurance. So what we want to do is we want to reduce that cost. We want to also just reduce any sort of opioid dependence that the hospitals themselves might be causing by prescribing patients who have never received opioids and giving them opioids. So that's kind of the point of this project. And so far what we've done is we're going to be looking at the population at UH Hospital, and we're going to look at patients who have received TAP blocks versus patients who have not received TAP blocks, and we're going to look at their outcomes. Currently we are undergoing IRB review, so we haven't really looked at data other than the demographics of the population who have undergone abdominal hernia at UH. And as you can see for the data, most of the patients are about 50 to 60 years old. Most of them are males. A lot of the patients are Black or African, and the other half is unknown. And also just looking at BMI is something that we want to look at as well. We want to see if that affects the outcome of TAP block. And for the most part, most of the patients are overweight, and there are a lot of them who are normal as well. So currently we are just waiting on the IRB review, and then we're going to start looking at the data for TAP block versus no TAP block. Yeah.
Hi, I'm Stephen Ornay, and this summer I did research with the neurosurgical department tracking outcomes of endoscopic endonasal surgery in the pediatric population. Traditionally, skull-based lesions were removed and treated with an open approach, where the brain was retracted, and that has a lot of side effects, obviously. So now it's a new approach that they're using endoscopic endonasal surgery going in through the nose. And we have a patient population of 24 patients who underwent surgery with this procedure for a variety of tumors and skull-based lesions. And we just sort of tracked the outcomes and side effects. And as you can see, we had many different tumors. It was a heterogeneous population. But overall, we had very good results, and it's proving to be a more popular approach because of the reduction in symptoms and better outcomes. So hopefully we contribute to the literature, and it was a fantastic experience doing this research.
Hi, my name is Parth. I'm a student at NGIT.
My name is Kellen. I'm a student at TCNJ, and we did our project on controlled dangerous substance prescriptions in a cohort of patients enrolled in medication-assisted treatment for opioid use disorder. So opioid use disorder is a major international public health crisis that affects over 11.5 million Americans as of 2016, and this is reported opioid abuse. MAT programs, also known as medication-assisted treatment programs, combine counseling, monitoring, and medication to try to treat this disorder. We utilized the New Jersey Prescription Monitoring Program, also known as NJPMP, to track CDS prescriptions. CDSs are controlled dangerous substance prescriptions in New Jersey. And so in our study, we use an IRB-approved prospective cohort study, and we got written consent from patients in outpatient clinics in Jersey City, Newark, Elizabeth, and Neptune. And we basically had access to their demographics, drug use, sexual history, date of birth, and we submitted their records, a total of 585, including duplicates, to the NJPMP database to try to match them with CDS prescriptions.
So we found that about 59% of the patients that we sent in matched the database, so they had been prescribed opioids by their physicians while they were in treatment for the past 2 years. We also made a distribution of how many of those patients, how many prescriptions they had been prescribed in that period, which is about 14. Some of them had up to 132. So this study is going to be building on, we're going to be building on this study in the future to try to see individually what kind of prescriptions they're getting, and the time interval they're getting these prescriptions, and who's prescribing them these medications, especially so we can see the timeline of which they're being prescribed these medications compared to how long they're in treatment. So comparing prescription timelines to before, during, and after they're discharged from these treatment facilities, so we can gauge patient compliance and the efficacy of medication-assisted treatment.
Hello, my name is Sebastian Acevedo, and today I will be presenting to you about muscular dystrophy and a protein called connexin 43. So this summer I got to research on the protein connexin 43 and its effects in muscular dystrophy. We studied specifically skeletal muscle and the effect that this protein might have. Within the model that we used, a mouse model, we anticipated, based on our research in cardiomyocytes, that we would find a significant difference between the MDX, the muscular dystrophy model, and the MDX S3A variant. The MDX S3A variant, according to our literature, is a modification of 3 serines to 3 alanine proteins within the connexin 43 protein. We anticipated that there would be a significant difference here in the lateralization or the progression of the disease. We found, based on our research, that this significant difference wasn't present within skeletal muscle. This tells us that muscular dystrophy as an illness is much more nuanced and more complicated than we originally anticipated it to be. In the future, we want to expand our research in skeletal muscle and in cardiomyocytes to further understand how to treat and how to better treat and help patients with muscular dystrophy based on the specific area that we want to target. Thank you.
Saloom. I'm an undergraduate at Rutgers University in Newark. I'm going into my junior year this fall, and my research is about sex differences in microRNA 145P levels in kidneys and aortas of mixed background and C57 mice. So what first got us interested in this research is the fact that more than 27.6 million people have been diagnosed with cardiovascular diseases by the American Heart Association last year, which got us interested about what causes these cardiovascular diseases. Vascular calcification is one of the most important factors, and according to many publications, bone morphogenetic protein 2 is a morphogen, an extracellular morphogen that majorly causes vascular calcification. However, bone morphogenetic protein plays an important role in bone growth and bone development. So deregulation of BMP2 actually causes vascular calcification and calcium deposition in the walls of the arteries. This, according to targetscan.org, microRNA 145P actually targets BMP2, which makes us wonder which made us hypothesize that if we induced microRNA 145P levels in humans, it would decrease levels of vascular calcification. So we tested the clotham urine mice module, which are calcified mice, vascularly calcified mice, and we saw the differences between control and clotham urine mice in aortas and kidneys. However, nothing appeared, no clotho effect appeared in the kidneys, but we saw significant effect in the aortas, which got us interested. Aside from the Klotho mutation, we found different sex differences in the aortas and the kidneys of Klotho and control mice, which is what we are testing right now. My future directions are testing the microRNA 145P levels in ovary-active mice, female mice, which are mice with removed ovaries, which means no hormonal effect is into play in the experiment. This is basically my research.
Hi, my name is Sonali Ahuja. I'm going to be a second-year medical student at New Jersey Medical School. This summer, I was investigating the question whether medical marijuana could help with opioid use disorder, which is a very relevant topic right now because in January of this year, New Jersey legalized opioid use disorder as a qualifying condition for getting medical marijuana. So as part of Dr. Weiss's lab, we have a bunch of data. We've recorded, we have interviews from patients who are enrolled in drug treatment programs for opioid use disorder, and we have surveyed them already on their behaviors surrounding using a bunch of illegal drugs. So one of them included marijuana, and we also have data on a bunch of other drugs. So based on their reported frequency of use of marijuana, reported frequency of use of opioids, and the time period during which they use these things, we were able to put this data together to try to answer the question whether those who were using marijuana at the same time as using opioids, whether that helped them use less opioids, as that's the thought right now behind legalizing medical marijuana for opioid use disorder. So amongst our at least daily opioid users, we had about 281 participants who fell into that category. We analyzed how much marijuana they were using. So our three categories are never used marijuana in green, less than daily marijuana use, and at least daily marijuana use. And then based on whether they used marijuana during the same time period as they were using opioids, we divided them into two categories. Those who false were not using them at the same time, and then true were using them during the same time period. So our big significant difference or finding that we got was that those who were using at least daily marijuana at the same time as using opioids were using significantly more opioids than those who also used at least daily marijuana but were not using at the same time as opioids. And that difference was fairly significant. Those who were using marijuana and opiates at the same time used about 49.2 times per week, compared to those who were not using at the same time used opioids about 19.6 times per week. And even when we stratified based on male and female, this difference still held. So the significance of these findings are that there's preliminary evidence, or like the law that was passed in New Jersey was based on preliminary evidence that marijuana could help with opioid use disorder. And the reason that is because marijuana is a Schedule I drug, which means that there's no federal money that can go towards really doing a controlled clinical trial to evaluate the efficacy of marijuana for opioid use disorder. But based on these results, I think it's fairly controversial whether marijuana is actually effective for opioid use disorder. And I think more rigorous clinical research needs to be done before we can have physicians start prescribing something, a course of treatment that is not proven to work. Thank you.
Hello everyone, my name is Paul Kande Jai, and I was fortunate enough to be part of Neuro 3 phase program here at Rutgers Jersey Medical School. For the past 2 months, not only was I able to learn about biostatistical methods and epidemiological study designs, I was fortunate enough to learn about how the environment can affect our health and our well-being. By doing so, I was able to work at Columbia University, Melman School of Public Health, in which I worked with Dr. Jeanette Stagone, in which we investigated how environmental metals can lead to adverse liver functions in the U.S. population. So basically, we all know how the liver is essentially a system that detoxifies metabolites, synthesizes proteins, and produces biochemicals needed for digestion. However, we learned through an article, Covered to an All from 2002 article, that environmental exposures to toxic heavy metals such as cadmium, lead, and manganese can lead to chronic intrahepatic exposure. Thus, the authors of the study indicated that prolonged exposure can lead to adverse liver functions and future liver diseases. So for the premises of this research, we want to focus this on the 3 toxic metals, such as lead, cadmium, and manganese, and we want to focus on a specific age population in the United States. We want to focus this on youth, ages 17 and below, and we want to see the various levels of ALT and GGT. Essentially, ALT stands for alanine aminotransferase, and GT stands for gamma glutamine transferase. And essentially, these are biomarkers that all of us have in our systems, and low levels of it indicates that the liver is functioning properly. However, high levels of it can indicate adversity at stake with the liver system. So we were able to use enhanced data sets, which stands for a National Health Nutrition Examination Survey, one cycle of it. And we were able to see a full sample of it, ranges from 2,127 participants, and when we stratified for the youth sample, it was 298 participants. So basically, in regards to the conclusions, we observed that youth ages 17 below, there was a significant higher direction of manganese and GGT levels. So essentially, for every 1 unit of manganese in the system, but for a child 17 and below, there's a 0.44 increase of GGT. And so basically for the limitations for the studies that we had limited high power. So the next step is that we're going to get a higher sample size in order to see any significance. So thank you so much.
Hello, I'm Ethan Tyree, and I did my project on remote ischemic conditioning impacts on cytokine gene expression. Basically, one of the biggest problems post-operation is inflammation of the organs, which can lead to complications or even death. So our intervention was to try to mediate this inflammation through ischemic conditioning of the legs. And through that, we put a little tourniquet around someone's leg before and after the surgery for 5 minutes to induce ischemia. And then we measured blood cytokine levels the day of, the day after, and then 2 days after. And you can see the gene expression of cytokines IL-6 and IL-8, which are both pro-inflammatory cytokines, remain about the same. There was no change in expression, while interleukin 10, which is a anti-inflammatory cytokine, actually was downregulated a little bit. There was less gene expression, which kind of showed to us that maybe this intervention isn't making a huge impact on inflammation responses after surgery. And for future considerations, we're thinking about maybe checking more time points in between the 2 time points that we checked to see if there was a curve, if gene expression had increased rapidly and then went back to baseline quickly after the surgery or the intervention.
Hi everybody, my name is Hadi Asher. I'm working on this project. We've done this work with the help of Dr. Sawaya and his neurology lab. We're very grateful for that. And basically what we're looking at today is there's a disease out there. It's called CIDP. It's a pretty rare disease, but if you're really interested, CIDP, essentially what it stands for, chronic inflammatory demyelinating polyneuropathy. It's a mouthful, I know. And if you're familiar with any of the medical terminology, it's essentially the chronic version of GBS, right? So basically what we're looking at is the symptoms you'll present with if you do happen to get the disease. You'll have dysesthesias, paresthesias, and basically what those are just tingling, numbness, any kind of thing like that. You'll have weakness, muscle nerve connections will be weakened. All those things will show up on an electrodiagnostic test, and that's what we looked at basically in this study, right? And while it wasn't specifically neurologically lab focused, we did do research through clinical studies, and the one database that we did peruse is called the VAERS database, Vaccine Adverse Event. And so we looked at a period between 1990 and 2019, and shockingly, the only case that we found were 100. So like I said, it is quite the rare disease. And so we do have some statistics. Basically, what we looked at is whether there's an incidence correlation between vaccination records and the onset of CIDP, right? Whether there's a correlation between those two. So what we found is, looking at the date of onset, that's the most important thing with this, is that within around 6 weeks, which is 42 days, you have about 14 people that end up with CIDP, right? Obviously, it's an adverse event. It's an adverse reaction to the vaccine. It is what it is. But basically, a lot of times this disease is overdiagnosed. And so by looking at this, we realize that it is overdiagnosed, but usually it's afterwards, right? Within the 6 weeks, you have a lot of people, but after that, it kind of falls off. Some other basic statistics we have, 27% of the cases reported did end up being life-threatening. We did have 44 patients who were left with permanent disability. It's just the nature of the disease. It is a rare one. If it does happen, it does happen. And if you can see here, this is the reason why it's really upsetting, is because a lot of times almost half of the people took the vaccination for influenza, right? It was a flu shot they took otherwise normal, healthy people, and so they ended up with this CIDP in reverse. And so when we compared it to non-CIDP cases, whether it's comparing to GBS, like I mentioned, MS, all those type of cases, which had an onset of about 6.8 days, we found that ours had about 26-day onset, right? And so we're looking at future studies, looking into things, going further with the studies, because it is quite a rare disease. And so what we have plans of looking at, we have other databases we can look at. There's a really renowned one called Sparks. That one we'll look at as well. And basically we'll peruse different statistical analyses problems, right? We'll look at, there's self-centered studies, case control studies, and through all those, that'll give us better ideas of what the disease really is about and whether there's a vaccination correlation or not. And so we'll continue to work with Dr. Sawaya and all his colleagues, and hopefully look forward to getting a real incidence, really real connection between these two, and look forward to a successful case.
Hello, my name is Rosemary Bamer Hansen, and I am a medical student here today from Rutgers, New Jersey Medical School, presenting on endoscopic endonasal transsphenoidal resection of pituitary apoplexy, assessing both visual and endocrine outcomes. So pituitary apoplexy is a rare outcome of having a pituitary adenoma or tumor on your pituitary gland, in which either hemorrhage or necrosis happens with the tumor, causing a clinical acute onset presentation of symptoms such as loss of consciousness, headache, visual, and endocrine disturbances. The objective of our study was to evaluate a cohort of 29 patients who presented with pituitary apoplexy at our Rutgers institution, and to look at factors such as timing of surgery. And so ultimately, we saw that while most patients did receive a diagnosis of pituitary apoplexy within 1 week of symptom presentation, we did see delays, where about a third of patients, or 29%, did experience a delay in pituitary apoplexy proper diagnosis. Similarly, we see that same trend with receiving surgery. These results are concerning because they may be associated with worsened visual and endocrine outcomes after receiving surgery. Ultimately, our presenting signs and symptoms most commonly were found to be headache and nausea vomiting, as well as visual acuity deficiency, ocular paresis, and a variety of endocrine abnormalities. We present here 3 cases of patients with pituitary apoplexy, both preoperatively and postoperatively, with a T1-weighted MRI. In these first 2 cases, we see gross total resection of that pituitary adenoma with preservation of the pituitary gland. I'll direct you to this final case where we had near total resection of the pituitary adenoma with preservation of the pituitary gland. Ultimately, we had 85% of cases received gross total resection of that adenoma. In terms of immediate postoperative outcomes, visual field, visual acuity, and ocular paresis, all of those visual outcomes were more likely to be normalized or improved, as seen with these blue bars. Endocrine outcomes, as you could see, were more variable, where factors such as thyroid conditions were sometimes worsened, sometimes improved. Finally, with pathology, we use the NOSP grading scale to grade tumors to see that this sample of patients did have a variety of NOSP tumor grade or severity, as well as a variety of presenting with hemorrhagic, necrotic, or both in terms of the adenoma apoplexy outcome. Importantly, no patients died from the procedure. There were very minimal postoperative complications, with only 1 patient receiving a lumbar drain. Very few patients in the minority were diagnosed with diabetes insipidus and postoperatively, and of those, only 19% required transient treatment for that, where very few required permanent treatment. And finally, 61% of patients required hormone replacement therapy immediately post-op, as demonstrated by these varied endocrine outcomes. And so we find that EETS is a safe and effective approach for surgical treatment of pituitary apoplexy. Visual symptoms were more likely than endocrine to be properly preserved immediately post-op. And importantly, we are seeing that about a third of patients received a delay from pituitary apoplexy to diagnosis, as well as from ictus to surgery. That could be concerning, as timely recognition of PA may further improve patient visual and endocrine outcomes after endoscopic endonasal transsphenoidal resection. Thank you.
So hi, my name is Mayuri Reddy, and I'm an undergraduate at TCNJ. Me and Catherine focus on the role of screening tests in diagnosing children with ASD, which is autism spectrum disorder. So in order to do this, we started with a cohort of children who were born in either 2006 or 2008, and these children were from 4 different counties in New Jersey. And within these about 60,000 children, about 10,000 of them had some sort of trigger that signaled that they had ASD or some other developmental disorder. And within these 10,000, about 1,000 of them had received a screening test. And then, so we looked at those 1,000 that had received the screening test, and we looked at differences in race, socioeconomic status, and gender. And we found that there were 4 different tests that were most prevalent: the MCHAT, the STAT, the ADOS, and the ADIR.
So within these tests, we are interested in looking at how sensitive they were at picking up ASD, because it's a very multifaceted diagnosis and it's hard to standardize. So we're trying to see if these tests can be to facilitate that. And also we were looking at the differences in administration, again, kind of towards that goal of standardization and assessing the current use. So we found that there was a racial discrepancy in the use of these tests, with Hispanic children receiving them the least. There was no gender or socioeconomic disparity. We also saw that there was actually no age difference in ASD diagnosis with and without the tests, which came as a surprise. However, it was noted that children who had received these tests received their first evaluations earlier, which in turn means that they can receive intervention earlier and hopefully improved outcomes. And that's one of the main goals of autism studies that are current. And so it's important to see that these tests can help towards that aim. And lastly, looking at the sensitivities, it's notable that although the STAT is one of the most commonly used, especially in younger children, it actually had a low sensitivity at approximately 60%. So we can get this information to clinicians and try to adjust that use. And we can try to shift it to the more sensitive tests, such as the ADOS and the ADIR, with the MCHAT falling in the middle. And so overall, it's important to try to assess the use of these tests, as we have done, to see where the state of these tests lie, and to see which ones we should be using into the future to try to catch as many children as possible, as early as possible, and to help them receive the help that they need to develop properly with this condition.
My name is Fabian Victoria, and my project is on the effects of audio-guided meditation on heart rates, cortisol levels, and stress 360 scale. So the subjects were entrusted to perform a 30-minute meditation every day and record their heart rates before and after the meditation, as well as they were taking blood out to check for the cortisol levels at the beginning of the study and then at the end of the study to compare them. Through the 21 days, we recorded the heart rates for the subjects, and we were able to see that there was a decrease in heart rates, although there was some variation on a daily basis. But the important thing is that we found that for every single subject, there was a decrease in the cortisol level. We tried to keep it as controlled as possible because we took the blood at the same time, but we still have subjects working on it, and we had to start with only 4 subjects. The importance of these studies is that we not only have to use medicine to reduce things like heart rates or blood pressure, and so we can use something different like meditation, which is non-invasive and you can do it at home, and it's really simple to use because it was an audio, and everything they had to do was to listen to it and relax and record the heart rates. So we had some limitations that we had to deal with. We had to trust completely the subjects that they were going to complete the meditation every day on the full 30 minutes, and that they were going to complete it under the same conditions, as well as recording the heart rates appropriately with an oximeter that they were given before the study began. for the future work, we expect to see more subjects in the study. We are working on it right now with more subjects, but this study is meant to have a larger scale and to see a better, a better result and more meaningful data. So that is my study, and I conclude.
Hi, my name is Camille Breshva. I'm currently a student at Occidental College in Los Angeles, California, and this summer I did research in Dr. Shu's lab at the Public Health Research Institute. And this summer I worked on the role of lipid flippase subunit CDC50 in Cryptococcus neoformans ergastral trafficking. So Cryptococcus neoformans is a human fungal pathogen that can cause fatal meningitis in immunocompromised individuals. And currently there are only 2 treatment regimens for Cryptococcus, both of which have serious side effects and also require long-term treatment regimens, which can open up the door for the emergence of antifungal drug resistance. So recently a paper found that CDC50, which is a lipid flippase subunit, did result and had a role in antifungal drug resistance. And so my role this summer was to study this mechanism of CDC50 and its role in antifungal drug resistance. And so what I found was I did find that there was a difference in terms of ergastral distribution in the CDC50 mutant and wild type strain, and that was really interesting because we believe that this varied ergastral distribution between the CDC50 mutant and the wild type strain might play a role in increasing sensitivity to these 2 classes of drugs to which it's currently resistant to. And so when we treated the Cryptococcus neoformans with the azole drugs, we found that there was actually an increased sensitivity to the azole drugs, which might suggest that this altered distribution of ergastrol on the plasma membrane in the wild type strain might actually lead to an increased sensitivity to synthetic lethality of the Cryptococcus neoformans CDC50 mutant. And so by exploring this role and seeing that the CDC50 mutant does play a role in antifungal drug resistance, we wanted to see whether CDC50 might be a good drug target. And what we did find was that CDC50 might be a good drug target if treated with antibodies, however, only in the absence of a cell wall, as the antibody was too large to actually penetrate the cell wall and actually bind to its drug target. So we found that perhaps maybe by designing a peptide, we would be able to actually have the small peptide penetrate the cell wall and actually bind to its drug target and render CDC50 ineffective. So while we did find that the azole drug did lead to increased sensitivity in the CDC50 mutant cells, future studies are still necessary to determine whether if CDC50 could actually be a good lipid flippase subunit drug target.
My name is Laura Yuan. I am an undergraduate student at the College of New Jersey, and this summer I worked with Dr. Mariana Di Lorenzo in the Department of Cell Biology and Molecular Medicine. So our research focused on evaluating existing literature as well as performing a series of our own experiments to determine the role of fibroblast growth factor 21, FGF21's role in cancer and its implications in various models of longevity and metabolism. So FGF21 is an important endocrine peptide hormone that is a complex metabolic regulator and plays a role in cellular and environmental stress response by mediating interorgan crosstalk. So in previous research published by Dr. Di Lorenzo, patients diagnosed with clear cell renal cell carcinoma as well as breast cancer expressed increased circulating levels of FGF21, which was associated with lower disease-free survival. So we examined the association between cancer and FGF21 levels using the 4T1 triple negative and the EO771 marine breast cancer models, and using various methods of immunohistochemical staining, we looked at its association with FGF21 levels. We also evaluated caloric restriction, which is a known mechanism of longevity, and its mimetics, metformin and orlistat, that are usually used to treat diabetes, type 2 diabetes, as well as obesity. And we looked at its association with cancer as well as with the proliferation activity of fibroblasts using PASR staining. So our data supported previous research to show that 4T1 tumor-bearing caloric restriction fed mice possessed reduced collagen expression in tumor and liver tissues compared to normal diet-fed mice. We also observed a substantial increase in FGF21 levels in conditioned media of B16F10 melanoma cells that were treated with a combination of both metformin and orlistat. So this research is important because specific calorie restriction-induced mechanisms of longevity are not well studied in humans due to the ethical limitations for long-term dietary control. But if we can better understand the roles of caloric restriction mimetics, such as metformin and orlistat, and their function and association with circulating FGF21, we have the potential to apply that to future human studies.
Hey, my name is John Yan, and I'm currently a first-year medical student. And what my research essentially was using a novel image analysis technique to look into something called epithelial wrinkles within a retraction pocket of the tympanic membrane, which is essentially our eardrum. And these epithelial wrinkles, otherwise known as epithelial ridges, are something we believe may be indicative of something known as epithelial migration, which is basically a movement of the skin. And what makes this important is that our understanding of retraction pockets and how they develop into a much more serious disease known as cholesteatoma is currently very vague, and epithelial migration has been one of the major processes that has been implicated in that. And throughout this study, what we found is a significant difference in terms of ridge quantity, ridge length, ridge density, and another specialized parameter we call a ridge index, which is basically if you take all these ridges within the tympanic membrane, line them up, and take that length, then that would be our ridge index. And we found significant differences between the cases and controls for all these parameters. And a possible explanation for this that we think might be occurring is that an obstruction sort of creates a blockage of epithelial migration and the normal movement, causing the skin to sort of go around the retraction pocket and causing a buildup of these ridges downstream, which then we see presented in our image analysis and what our macro in this software can detect.
Hello, my name is Michelle Carvalho, and my poster is about a community service project done by Dr. Natali to increase the rate of colorectal cancer screening in minority communities. Why is it important? Because colorectal cancer is the second cause of cancer-related death in the United States and the fourth in the world. However, this type of cancer is curable if detected in early stages. The most common method of screening nowadays, it is called FIT test, which stands for fecal immunochemical test. The purpose of this project is to educate participants about colorectal cancer and the importance of screening for prevention and early detections. Also to understand and address barriers that are preventing these participants to get screened. The way that we do it, we participate in educational sections, and where we educate participants, we also distribute FIT tests for free, and we follow up with the participants to ask them what is the limitation for them to get screened.
Hi, I'm Samanthika Devalaraju. I'm a rising second year at NJMS. I did research on the HCV care continuum in 2 MAT clinics in urban northern New Jersey. So we were looking at why there's a fall-off in the care from patients needing treatment to being cured or attaining sustained virological response. So first we ran the demographics on the clinics, and we found that a majority of them are injection drug users and also white non-Hispanic, and we also saw that a majority of our patients were also insured, and we ran a cascade from patients being interviewed to being tested to being told that they're HCV positive, and also we wanted to see how many of our patients attained spontaneous viral remission. These are the 2 care continuums. One of them is from 2016 to 2017, and one of them is in 2018. So we want to see the difference in getting cured or attaining sustained virological response. We did see a significance from 2016 to 2018.
but we also saw more reasons why there is a failure of treatment in many of the steps that are part of the care cascade. So the most common reasons are transportation problems, the treatment being too expensive, or drug use. So with transportation problems, a lot of the patients can't go to the treatment off-site because in these clinics, most of the treatment is being referred to outside hospitals, and a lot of our clients don't have the means to get to those hospitals. Treatment being too expensive with the direct-acting antivirals that are offered. There isn't any patient education on how many of these patients face barriers to treatment. And with drug use, a lot of physicians don't understand that HCV is most prevalent in injection drug users. So they're not treating this population itself. And it's most important for physicians to understand that whether or not these patients reinfect themselves, it's important to get them treatment right away. And that's what my project is about. It's just HCV care continuum in 2 MAT clinics.
It's over the educational value of YouTube videos on dementia using the discern model. My name is Christian Zaff.
I'm Christopher Rojas.
As an introduction, dementia is a neurodegenerative disease characterized by a loss of cognitive function. Most of the research is looking into the cause of Alzheimer's disease, which is misfolded proteins in the brain. A lot of the medication that's currently being researched focuses on the symptoms of the disease and the progression of the disease. We found the inspiration behind our research by noticing that caregivers and patients may want to self-educate themselves using services such as YouTube, and we wanted to evaluate the educational value of these videos.
So how we got everything done? First thing we did was Google search trends that refer to the references. So the top 3 choices were dementia, Alzheimer's disease, and memory loss. After this, we organized the video into 2 different categories between view count and relevance. After we conducted and gathered all our videos, we used the discern model in order to grade them. The discern model was 1 to 5, and then through these gradings, we averaged them all out. Together, to stop the biases, we used 3 different reviewers, myself, Christian, and Dr. Bacarizo. And we conducted and watched 53 videos.
So for our results and the discussion of our data, in the bottom of our poster in the middle, you could see an example of the discern model. There's 16 questions, and they're graded from a 1 through a 5. 1 would be a complete no, and 5 would be a yes. For example, are the aims clear? Do we have a balanced and unbiased video? The average score across the 53 videos was a 1.87, and it shows that there's a low quality of consumer health information on these videos. Although there is a low quality, this doesn't mean that all the videos were poor. UCLA Health probably had the highest video rating of a 4. This video included an hour-long lecture with an MD. All the sources were included in the video. There were also treatments, benefits to the treatments, and risks to the treatments that were addressed. There were also certain videos and patterns that we'd like to address as well, where there would be trending videos on YouTube, especially prank videos that had no medical value but were very popular when we had the search, and this could show an obstacle that a certain patient might face. No cure for the disease and ongoing research could also make comprehensive videos problematic because new avenues may be being researched and discussed elsewhere. So for future direction for our research, we'd like to add more graders to our research team, ideally to double the amount of graders to help with the reliability and the consistency of the scoring. We'd also like to finalize the project and address a typical user's experience. And we'd like to thank Dr. Antonio Mamis and Dr. Humberto Bacarizo for allowing us to be a part of the research meetings each week. Thank you.
Hi, my name is Rebecca Cuevas. So I'm studying the effect and role that gender has on fellowship completion. It's known that women are more likely to complete medical school compared to men, and they do actually comprise a greater percentage of the student population. However, they're seen less in the actual field. Women only comprise 17% of neurosurgeons. So we decided to do a quantitative study of fellowship of trading information, and we analyzed everything based on gender. And we found that women are more likely to complete pediatrics and critical care and trauma, while men tend to choose vascular and spine. So the gender gaps are pretty evident, but very little research is done on the actual why, like what factors are pushing them into these fields or pushing them away. So we designed a preliminary study that will be sent out hopefully within the next month or so to actually assess these factors. So that's the future work at the moment.
Hi, my name is Edwige. I'm a rising first year at Rutgers University Medical School. My project was on looking at long-term risk factors among patients who have experienced intimate partner violence, using retrospective chart data analysis and conducting chart review. The Domestic Violence Intervention Program screens patients in the OBGYN and the Family Medicine Clinic, and between July 2018 and January 2019, we had 275 patients who were screened. Among those, 15 screened positive as being current victims of intimate partner violence, whereas 19 reported experiencing intimate partner violence in the past. But of those 19, 4 were current victims as well, which is interesting to see. We also looked at the distribution of different forms of violence, and most victims were reported being insulted or screamed at. So chart review was conducted to try to see what chronic conditions were prevalent among victims, and asthma was the most common prevalent, but these findings were limited because we didn't have access to the current electronic health records. In terms of victims who screened positive, they're offered services, and more than 50% reported interest. 50% reported interest in support group or counseling. A quarter also reported interest in behavioral health, and research have shown that early identification of intimate partner violence victims and referral to mental health and physical health programs is beneficial to these patients.
I'm Carla Larios. I'm an undergraduate from Rutgers, New Brunswick, and I was working on Dr. Contreras' lab that focuses on connexin hemichannels. Connexin hemichannels are just 2 channels that bind together and form gap junctions. Gap junctions facilitate the intercellular communication between cells through small molecules and ion-dependent exchange. So we focused on using the 2 electrode voltage clamp technique to study the function of 2 specific connexin 30 mutants, G11R and A88V. We looked at the phenotypical conditions that oocytes were in, and we performed protein purification techniques like the Western blot and electrophysiological techniques like the 2 electrovoltage clamp to study the function of the channels. We concluded that both mutants have a gain of function compared to the wild type in ion-dependent channels, and for future direction, we will be performing dioptic techniques to study the transfer of ions and small molecules like ATP in our oocytes.
Hi, I'm Yuzan Kadkoy, and I will be presenting the effects of BMOV and how it enhances fracture healing in rat femur. So insulin has been shown to enhance fracture healing. We investigated some insulin mimetic compounds, which through downstream regulation can actually upregulate the activity of the insulin receptor, and to see its effects on fracture healing. So the compound we chose was BMOV. It's an organic vanadium complex, and we basically introduced it to a rat during surgery, and then we induced a fracture. We then took these rats out to a given number of days based off our parameter that we were checking for. So we assessed histology, micro-CT, and mechanical testing. What we found was that across the board for all mechanical properties, BMOV had a positive effect on the fracture healing with statistical significance at peak torque. For the micro-CT analysis, we found that BMOV had a positive effect on the amount of mineralized tissue within the fracture callus at the 4-week time point. At the 3-week time point, we found that the control actually had more mineralized tissue, and we believe that this is from an effect on chondrogenesis that we see with vanadium compounds. So you can't pick up this cartilage within micro CT, so that's why at the 3-week time point we have less, but then that cartilage turned into mineralized tissue and we see the increase at 4 weeks. We also did an analysis of pixels for every micro CT within the given slice of the fracture callus here, and you can see how many of those pixels going in the Z direction span the length of the fracture callus. So at 3 weeks, like I said before, the control had more bridging across the callus, and we think that this is from the cartilage that you see. And then at 4 weeks, we had an increase for the BMOV group. This was also supported by our histology data, which found that there was more mineralized tissue for the BMOV group at the 4-week time point. We also had an automated radiographic scoring, which found that there was more overall bridging within all 4 cortices for the BMOV group. So this is a really exciting field right now with the insulin mimetics and their effect on fracture healing. And our next steps would be to investigate different carriers for our compound. So right now we're looking at calcium sulfate and to see its effect on delivering the BMOV to the fracture site and having a sustained release.
Hi, my name is Fatima Hussein. I'm an undergrad student from Rutgers, Newark, and I'm currently participating in NERA-3 research, in which I had the opportunity to be a part of the project under Dr. Contreras' lab, in which we pretty much tested over connections. So connections, what are connections? So connections are part of the 21 human genomes, and what I particularly did was connectin 43, in which we tested to see if we can find a cure for muscular dystrophy and arrhythmia. So what I technically did is we tested blockers in which to see if it prevented or reduced the opening of hemichannels. So what my whole project is about is we're trying to see if we can form or like hypothesize if we can find a cure in amount of blocking the hemichannels in our body to open up. So as predicted from here, this is the non-injected, this is the after-injected. As you can see, this is connectin 43 expression before caffeine, and then after caffeine there's an increase of current and there's a lot of openings of calcium channels. So what we want to do in my entire project is to limit the amount of calcium channels from opening up. So this is with the connectin 43 and Bolden. As you can see, before perfusing caffeine, after caffeine, caffeine induces it and gives a lot of current. And then this is after Bolden. Bolden did inhibit the amount of calcium channels from opening up. So we predicted, came to a conclusion, and this is to show overall the normalized caffeine dependent. As you can see, as predicted, it increased with non-injected, increased with connectin 43. Bolden, it did the same thing, because as caffeine induces, and it induces the opening of hemichannels in our writing receptors. So this is all 15 minutes together. As you can see, this is connectin 43. This is with non-injected, this is with Bolden. So Bolden did inhibit the amount of calcium channels from opening up. So overall, this is a resting membrane potential for non-injected, connectin 43, and with Bolden. Overall conclusion, with Bolden, it decreased the amount of resting membrane potential, which possibly can mean a lead to finding a cure for arrhythmias and dystrophies. So we came to a conclusion that caffeine affected the resting membrane potential, and it induces the connectin 43 hemichannels activities, and we overall said that Bolden inhibited the number of connectin 43 hemichannels under the influence of caffeine. And our future directions is to test more antiarrhythmic drugs to see if we can find a better blocker than Bolden. And I would like to thank Rutgers NJMS and the NERA program for allowing me to be a part of this. Thank you.
Hello, my name is Stephanie Pericho, and our project is called Exosomes Key to Neuroregenerative Medicine. I worked in Dr. Pranella Rameshwar's lab, and our focus was on exosomes. The reason why this is so important is because currently in the clinical setting, we have a big problem with neurodegenerative diseases such as Parkinson's, Alzheimer's, and spinal cord injury caused by neural failure. So what people have been doing in the past is they've been transplanting neurons into patients, but this is both somewhat controversial and expensive, so we're trying to think of other ways that we can regenerate neurons in a patient. The way we thought of is by using exosomes that cells release as they differentiate into neurons. And the reason why we believe that these exosomes can differentiate cells on their own is because exosomes contain a lot of genetic material such as RNA and proteins and enzymes. So what we did was we induced stem cell differentiation using the regular regular neuronal media. And the reason why you can't use that in a patient, for example, to induce neuron formation is because there's chemicals such as retinoic acid. So exosomes are an organic way that you could put into a patient and it would help make neurons. So what we did was we plated cells and we turned them into neurons. Then we characterized the exosomes to see the concentration and the size, and we added them to a fresh plate of stem cells. Although it takes 12 days to effectively make a neuron, we only had maybe 4 or 5 days of actual time with this, but we're going to continue our work. After 24 hours between regular differentiation media and the exosomes on an organic growth media, you can see that there's a lot more proliferation with the exosomes in organic growth media. So not only is it working that they're becoming neurons, it's actually working more effectively than the original differentiation media. We have no exact conclusive results that they're neurons, but it's a good sign that they're becoming when they proliferate. In the future, we're going to stain them to make sure they actually became neurons.
My name is Emily Fernandez. I'm a part of NARA3 research. The title of my project is called Design of a Novel Platform for Interbacterial Drug Metabolism Studies. And the goal of this research was to determine the amount of antibiotic accumulated within E. coli and also to determine the generation of metabolites produced from the antibiotics. So as a control, we used MG1655, and as our independent variable, we used INP 4213. The difference between these two strains is that INP lacks a liposaccharide transport protein, making its outer membrane more susceptible and permeable to antibiotics. And the antibiotics that we used were streptomycin, carbapenem, and rifampicin. And as a conclusion, we determined that the drug accumulation within the E. coli from the antibiotics was that streptomycin and rifampicin had a low percentage amount compared to carbapenem.
Hi, my name is Alex Lin. This is Jasmine Lin and Brittany Ward. We are all second-year medical students. This summer, we worked with our PI, Dr. Alice Chu, from the orthopedics department at NJMS. This summer, we investigated the role of the trapezius muscle in young patients with a condition called obstetrical brachial plexus birth palsy. Now, what we know about the trapezius muscle in healthy subjects is that it plays an important role in shoulder function and stability. But this is not well documented in these patients. So we wanted to see the role and activity of the trapezius muscle, and we isolated the upper and lower portions of the trapezius muscle in this study.
We used the motion browser, which is a new way of visually looking at data that was actually produced out of NYU by one of the computer scientists, Gromit Chan. And we looked at 5 different patients and their muscle activation and also muscle displacement when doing 6 different motions. You can see here that this is actually how the motion browser breaks down each individual muscle data into muscle usage. And then here you can see it's as a portion of the whole. So we were able to use this data in order to, further look at what muscles were activated.
After collecting the data about individual muscle activity, we isolated both upper and lower trapezius activity and looked to compare the muscle activity between the unaffected and the affected arms of our pediatric patients. What we found was that the trapezius was selectively activated for a variety of all patients in a variable manner, thus indicating that the trapezius muscle is important in compensatory mechanisms for these patients. This is important to our clinical study because it shows that the trapezius muscle in these patients with OBP-BP may actually play a larger role in upper limb movements than was previously understood. So as a result, our study is pointing to promoting more research in the role of the trapezius muscle in OBP-BP and also questions the use of the current surgery that would denervate the trapezius muscle in order to restore function to the shoulder. Thank you.
Hi, my name is Neil Shah. And I'm Matthew Linz, and this summer we've been working with the bacterium Staphylococcus aureus. So staph is carried by up to 30% of the population, and the methicillin-resistant strain of staph called USA 300 is epidemic in the United States, and our lab focused on a acute pneumonia model in mice. And so the overarching importance of our study was that staph is only treatable with a few drugs, and so drug development is really important. So we were interested in characterizing new genes involved in pathogenesis.
So to develop some of these genes and find this target list, we actually use something called TN sequencing, which is transposon sequencing that in conjunction with massively parallel sequencing helped us identify a target list of about 50 different genes that have not been created in that mutant versions of staph have not been created for. And then of this, these 50 genes, we chose 12 that are high scoring on our target list, which is shown right here, that are that we wanted to make mutants for and knock them out. And so one of the main challenges of knocking out genes in staph is that it has a very strong restriction modification system that prevents uptake of foreign DNA. And so to circumvent this challenge, there's actually a mutant strain of E. coli that was created that would incorporate a staph aureus methylation pattern and also remove the E. coli methylation pattern, which will allow for more efficient uptake of DNA. And so once we get the plasmid DNA inside of staph, we actually use this PI-MAME vector to cause the allelic crossover event to occur, which allows for uptake and then integration and then eventually excision of the gene of interest. And this is all directed to using homologous regions that cross over. And so this is a workflow of what we've done for this experiment so far, and right now we're actually still transforming into staph, and we have a couple of mutants that are already ready to go through the last step, which is confirming the excision using PCR.
And so in terms of future directions, we hope to characterize the functions of these genes through a series of experiments, including killing assays with mouse macrophages, hemolysis assays with mutant strains of the bacteria, and RNA-seq to characterize hypothetical functions.
Hi, my name is Yasmin Hamam. I'm a second-year medical student at New Jersey Medical School. So my project was dealing with palliative care and trauma patients here in our hospital. We were looking if palliative care timing makes a difference in terms of outcome. The outcomes we were looking at were ICU length of stay, intensity, and just overall if patients were withdrawing care sooner, if they were getting palliative care contact sooner. So the three groups we had were no palliative care contact, early palliative care, which is before 72 hours, and after late palliative care, which is after 72 hours. And we did find that patients that received palliative care earlier had better outcomes in terms of less unnecessary procedures and a shorter length of stay.
Hi, my name is Samnath Ganapa. I'm a second-year medical student at NJMS, and this summer I did a project with Dr. James K. Liu, who's a neurosurgeon at University Hospital. The title of our project is Assessment of Myelopathy Outcomes After Endoscopic Endonasal Odontoidectomy. So the odontoid is actually a part of the C2 vertebrae, which you can see in this poster. In some patients with physical abnormalities, this odontoid can compress the spinal cord. And when that happens, it leads to a lot of different myelopathies, which a myelopathy is any disease involving the spinal cord. And this can present in a wide range of symptoms. For example, a patient can have complete paralysis of their upper limbs or lower limbs. So our project deals with a specific way that a neurosurgeon is able to deal with that problem. It's called odontoidectomy, which is where they go through the endonasal route and then take out part or completely remove the odontoid. And this leads to decompression of the spinal cord and hopefully resolution resolution of the symptoms. Now, in the literature, when neurosurgeons describe whether or not the patients have improved in their symptoms, they tend to use somewhat ambiguous terminology, like saying that the myelopathy has improved or stayed the same or gotten worse. And so what we seek to do in this project is use a objective criteria borrowed from the orthopedic department called the TMJOA score, apply that score to a pre-op description of the patient's symptoms and a post-op description of the symptoms, and see if there's an objective change in the myelopathy outcomes. So what we found was that endoscopic endonasal approach, odontoidectomy, resulted in excellent decompression of the spinal cord, and it led to an improvement of the patient's symptoms in 8 out of 9 patients, while 1 patient had the same symptoms as before. And so we applied the criteria, the TMJOA score, and found that there was a mean increase of 3, which means that there was an objective increase in or improvement in the patient's scores.
Hey, so my name is Harrison Chu. I'm currently a student at Rutgers, Newark. I worked with Ali Grelick from Drew University on this project, and what we're studying are the demographics of gun violence in New Jersey. So just to give you some background information, New Jersey has the 2nd strictest gun laws as rated by the Giffords Law Center, and we also have correspondingly the 5th lowest rate of gun violence. So we know that different gun policies and different laws do decrease the rates of firearm-related homicide and gun laws, but so far there have not been targeted interventions. So some factors we know influence it are housing, financial, social instability, all contribute to gun-related violence, but not much has been done about that yet. So we looked at the National Violent Death Reporting Service. So that had 2 databases, the New Jersey State Health Assessment Data and Whiskers, Web-Based Injury Statistics Query and Reporting System. So looking at those 2 databases, we were able to extract county demographics as well as demographic information about the individual. So here you have a bar graph displaying age-adjusted death rates between race ethnicities between counties. So right away you can tell that there are not only different races here, like black non-Hispanic males tend to experience higher rates of homicide, whereas white males tend to experience higher rates of suicide. So different races and different ethnicities experience firearm-related death differently. This is even more magnified here. So you can tell that the highest line here is black non-Hispanic. So black non-Hispanic males from ages 15 to 34 years experience significantly higher rates of homicide. P is less than 0.05. So we performed ANOVA as well as students' t-tests to verify this. So based on these findings, some of the recommendations we're making are targeted demographic approaches. So tertiary interventions such as case management and emotional management courses for black non-Hispanic males may help reduce the rate of homicide, as well as counseling outreach for white males since they experience higher rates of suicide. Some of the interesting circumstance variables we found through Whiskers were that homicides were more likely to be committed by a friend or acquaintance rather than a rival gang member. In fact, friend or acquaintance was about 40% of the time, whereas gang members were only 2% of the time. So that's why we're, again, recommending the emotional management courses. More than 50% of female homicides are IPV related. So for females, we're recommending that there be IPV screening within clinicians and within family medicine practices. Some of the limitations are that we had a small data set with limited variables. So future research will investigate the race ethnicity, like instead of looking at groupings, looking at self-identification, as well as some other circumstances that may influence gun violence recommendations. Thank you.
I'm Pierce Cooper, and I did my study on the acoustic correlates of pulsatile tinnitus. So pulsatile tinnitus is essentially where you can hear an auditory sensation that's synchronous with your pulse. And in the case of vascular pulsatile tinnitus, it's thought that this sound is coming from either turbulent blood flow in the vasculature around your ear or a structural abnormality in the bone or vasculature surrounding your ear that allows the sound of your pulse to reach your tympanic membrane, which you will then hear. So in our study, we wanted to come up with a way to objectively measure this pulsing sensation in the inner ear. There have been 2 previous studies that have taken transcanal ear recordings to try and measure this as well. And so we took this methodology and then tried to refine refined their method and then added 2 cases that haven't been previously studied using this method for carotid dehiscence. So these are some of the findings that we have. Most notably subject 4 with a bilateral carotid dehiscence, and you can see on the graph this kind of doublet pattern, and this doublet pattern is the same as what would come up when you're doing a carotid auscultation at the level of the jaw during a physical exam. So it would make sense that if you're hearing your carotid pulse in your ear, that sound would be similar to a pulse listening to it on auscultation as well. So the current study has 7 subjects, and to get some more statistical significance, it would be nice to get a larger cohort of subjects so you can detect patterns in larger groups as well.
Hi, my name is Len Florard.
Hello, my name is Mohammed Sheikh-Ali.
Hello, my name is Gabriel Colley.
Hello, my name is Cyan Richardson, and we are presenting UHVIP, Ensuring Safety and Health Through Better Practices. An HVIP, or a Hospital Violence Intervention Program, is a program that is set up for victims of traumatic injuries such as gunshots and stabbings and other violent crimes. And the objective of this project was to research best practices of hospital violence intervention programs, as well as economic benefits, in order to offer suggestions for the University Hospital HVIP, which was set up 2 years ago.
So how we went about researching was we did an extensive literature review on the major HVIPs in major cities, which we'll be talking about later, such as Detroit, Philly, Baltimore, and some Southern California. We use websites such as Google Scholar, PubMed, other government websites. And we interpreted Newark police data to find some risk factors and pedestrian struck hotspots. And we also did a cost analysis on the HVIPs, which we'll be discussing later in the results.
So essentially, we were looking for factors that increased efficacy, and by efficacy, we mean factors that decrease the recidivism rate and increase the cost savings compared to the city cost of violence. And through a cross-dimensional analysis of all these factors, we found that the older HVIP programs tended to have the highest recidivism rates, but this correlation was not a causation because these older programs were usually established in places that had a higher recidivism rate to start with. However, these older programs were more efficacious because they satisfied most of the practices, and they also had the highest cost savings. And as you can see, like here, Baltimore MD satisfies almost all the criteria, and it's the oldest, while the newest one in Newark satisfies very little of the criteria, and we're still waiting on the data for that.
So we also looked at which practices would be best to adopt for Newark and Essex County, and later on for New Jersey, the state itself. And we found 4, promoting hospital buy-in. So that's basically increasing the program's reputation within the hospital and hospitals in the area. This should also increase its reputation within the area, and that will allow us to have a wider scope. Provide more necessary services to victims. So a lot of the services we do provide very personalized, but it's not in a very structured format. So if we could hit these 5 services: employment, mental health counseling, housing, education, and maybe something else that is specific to this community, then we should be able to increase the efficacy of the program. Frequency, so based on the review of all the HVIPs we've looked at, it tends to be maybe 6 visits from our violence intervention specialists in 3 months. That seems to be the sweet spot for frequency. Currently, we fall below that, around 4 visits per 3 months. and we need to develop strategic partnerships with local community organizations. And this means that finding each of our services and bringing it out into the community through partnering with the organizations that are in these locales.
Hello, my name is Tyrell Edwards, and my research project is about a nutritional workshop to educate adolescents in an urban community to make healthier food choices. Studies have shown that environment and social determinants of health, such as food insecurity, which is the limited access to sustainable and healthy options, play a major role in diet. And diet has also been identified as a modifiable risk factor to cardiovascular diseases, diabetes, and obesity. And what we find is, in research, is that a lot of in the low-income urban communities, especially ones with increased minorities, compared to their white neighborhoods, we see that their community has a lot of food swamps, which means there's a lot more unhealthy food options accessible to them than there are healthy food options accessible to them. And so I wanted to create a workshop for the adolescents in the community. And adolescents, we focus on adolescents because the studies have shown a trend that from compared to the previous years, that adolescents are there's more prevalence of premature CVDs in adolescents than has been in the previous years. So that's really why we focus on adolescents, and this workshop is really to help them increase their confidence, skills, and knowledge in choosing healthier food choices in a fast food community, such as a fast food saturated community. Such as food swamps. So the workshop, we had 19 male students. They took a pre and post survey as well as a pre and post quiz to assess their attitude, skills, and knowledge. We created a curriculum with about 7 objectives. And then from looking from pre to post, we see that the students did gain a positive increase from pre to post in their knowledge quiz questions, as well as their attitudes and skills and questions. One question we asked after the workshop is, after attending, do you feel you can make better food choices in the community? 80% of the students agreed to this. So they really grasp that attitude aspect about dietary choices. And overall, we just had a positive response. We did want to look at protective and detrimental factors, such as household types. How does the adolescent's diet compare to a single and a 2-parent household? However, our sample size is a little small, and we couldn't get significant data for looking into those factors. So in one of our future directions is to create a bigger sample size. So all in all, I believe this workshop did work. This is a pilot study, so it's just to gain some data to see if we got a response, in which we did get a positive response, and we did hit our goals, because the majority of them feel more confident in choosing the healthy dietary options in their community.
Hello, my name is Justin Gold. This summer I worked on a health literacy project titled Health Literacy Among Surgical Subspecialties, Readability of Online Patient Materials for Surgical Procedures. And we first conducted a literature review and found that 76% of American adults access the internet, and of these American adults, 80% access the internet for health information. So online patient education materials are abundant and they are important. We found that the NIH and American Medical Association recommend that online patient content be written at a 6th grade level, likely due to average American adult reading level at the 7th grade level. We also found that low health literacy levels contribute to $100 billion, over excess of $100 billion, and we also found that low health literacy levels, patients have poorer outcomes and increased emergency department visits. So going to our study, we found, we included 7 surgical subspecialties, and we included the 5 most common procedures for each surgical subspecialty. We found this information and the specific surgeries through the ACGME, which had information on the most common procedures. After doing a Google search of these procedures to access the health information, we ran a readability studies through FRE, FKGL, FRIGRAPH, SMOG, and we found that the readability consistently for thoracic surgery was the lowest. It was the hardest to understand, and it correlated with the highest grade level. This is significant because initially we predicted that surgical subspecialties that treat more prevalent diseases such as that treat less prevalent diseases such as neurosurgery would have lower readability levels or more challenging readability levels, and this was kind of the exact opposite with thoracic surgery, as thoracic surgery treats many common prevalent diseases, yet also had the most challenging readability scores. One thing that we're hoping to do in the future is to analyze patient education materials and visual aids, because that's also common. This only analyzed text, so that's something that we're looking to unfold.